This week on Roadmap, we're going to talk a little bit about functional therapy. I'm Ralph Preston. I'm here with William Lowe. We do this on a regular basis and post them on YouTube. And William, you were going to start us off with a little overview about what constitutes functional therapy.
Yeah, sure. So I can kick off this week's discussion. I think when it comes to recovery after stroke, it's always good to think of your recovery in terms of what are some of the things I can do which can allow me to get back more function of my body and more function and more use of my hands and legs after my stroke. And the way I believe you can make this happen a lot quicker and a lot sooner is through functional therapy. And in a sense, functional therapy basically means doing things or doing exercises in your recovery in such a way that you're promoting or allowing your brain to get back more use of your hand on your leg. And basically what this implies is that you're applying whatever your brain has gotten back to real life straight away so that you can start to do some of the things you used to do before your stroke on an everyday basis. Because when you think about recovery after stroke and some of the things which you're trying to learn how to do again and how you're trying to wake up your brain, essentially what you're doing is you're trying to get back to that place before your stroke where you never really sat down on a day-to-day basis to practice one movement such as moving a hand, but rather the movements which you did every day using your hands and legs, they were integrated with your day-to-day life. So you would use your hands every single morning when you would open drawers, or you would use your hands every morning to help you with daily tasks like, obviously brushing your teeth, having a shower, folding clothes, doing laundry. So in a sense, functional therapy and recovery after stroke, it's the idea that if you're serious about your recovery and you really want to accelerate the recovery process and allow your brain to connect the dots a lot quicker, one way to do that, and the best way to do it, is to apply whatever your brain has gotten back after your recovery to real life as soon as possible and as often as possible. And why this is important is because whenever your brain gets by something in recovery after stroke, it can forget it as quickly as it got it back, because your brain doesn't remember things it's gotten back as much as you did before you had your stroke, obviously because of the nature of brain injury and because of the stroke. So if you want to make things permanent, and if you want to remind your brain why it should keep working on a specific movement so that it's integrated permanently into real life, then the best way to do this is to apply it straight to real life in a task which is relevant to something which is relevant to your everyday life. So for example, if you're in a situation and you're a stroke survivor and your hand is open enough, relaxed enough to be able to maneuver your fingers around a fridge door, then one way to obviously encourage your brain to keep those fingers open all the time, rather than allowing your fingers to get balled up in a fist, is to try and open the fridge door whenever you have the opportunity to, just to remind your brain why it's important to keep those fingers relaxed, because you're doing it on an everyday basis. And I mean, that's just one of the activities which constitutes functional therapy, because you're actually applying whatever function you've gotten back in your stroke to real life at the same time. Another example of this might be something like teaching your brain how to flex or press down your thumb properly. So for a lot of stroke survivors, quite often when they try to press down their thumb like they would when they press down on a remote, they find that the tip of their thumb actually bends down and buckles rather than it coming down in a controlled fashion. So if that's the case, one way to teach your brain how to actually apply this to real life so that you're not buckling is to do something as simple as, getting a credit card, and then asking someone to try and pull that credit card away from you and making sure that when you're pressing down and trying to stop them from pulling the cart away from you, that you're not buckling your thumb, but you're trying to teach your brain to flex down your thumb in a controlled way so that whenever you take out your card or whenever you're trying to grab onto something in real life outside of your exercises, your thumb doesn't want to buckle down like this, like it wants to, but rather it's able to flex down in a controlled manner because that's what you've taught it. And I think the more times you do something like this, or the more times you expose your brain to the correct way of doing something in a functional way, then you're more likely to teach your brain the correct way to I guess, perform a functional exercise or functional movement for the rest of your life, which will obviously improve the quality of your life, because whenever you pick up something, whether this be a tennis ball or an object, your thumb won't want to buckle like this, but rather it will want to come down in a controlled manner so that your thumb can meet your index at the same time. And as you can see, this looks a lot like pressing down on a credit card where my thumb is almost touching my index finger, and the only thing separating the thumb and the index finger is obviously the credit card itself. So opening up the fridge door and obviously using whatever your movement you've got, such as thumb movement to real life. Both of these examples I've shared here, they're just examples of functional therapy. And as you can see, the common theme here is that once you get a movement back in recovery after stroke, if you're serious about seeing more changes in your recovery and actually making this movement permanent in your life so that your brain doesn't forget it, the best idea is to apply it as quickly as possible to real life, to something which is relevant and something which is functional to your everyday life. For example, opening the fridge door, doing some dishes. Maybe you could use your hand to hold, maybe you could use your affected hand to hold a plate while you use your non-affected hand to clean the plate at the same time. As you can see, holding down the credit card, this is the same thing your thumb would have to do if you're holding a dish with your non-affected hand. And then obviously with your affected hand. And obviously with your non-affected hand, you can wash the plate at the same time. So the reason why I think this is important is because, like I mentioned earlier, your brain, unfortunately, it can't remember things as quickly as it's gotten them back in recovery after stroke as you did before you had your stroke. And as Ralph and I have mentioned in the past in previous roadmaps, in recovery after stroke, especially when it comes to movement, there's no such thing as setting it and forgetting it. In other words, as soon as you get something back in recovery after stroke, that's your brain telling you that this is your opportunity to jump on this movement. And if you don't jump on this movement, then you're going to probably forget it. And it's going to be even harder to get it back because your brain would have developed really bad habits. And quite often it's a lot harder to learn a new habit, a new movement after your brain has gotten away with a lot of compensation movements than it is to correct something. So Ralph, you and I earlier, before we sat down for this discussion, we had a conversation about some of the things you did in your recovery, especially in the early days, about how you applied this concept of functional therapy to your life. I'm just wondering, for the folks who are watching this right now, I think it would be really beneficial for them to obviously see, I guess, a behind the curtain sort of look at how to apply functional therapy to real life. And I know for yourself, you use this concept, you lived and breathed this concept of functional therapy pretty much in your life. I was just wondering if you would like to share, I guess, a day in your life in the early days of your stroke and how you applied functional therapy to help your brain connect the dots in your recovery.
Yeah, it's interesting that you use the word integration in your early on in your opening there, because when I was in the rehab hospital, I learned they talked about the concept of involvement. That they meant involve your affected side in as much daily activity as you can. So I'd gotten that much, and that got me off to a good start, I guess. And At the time, after my stroke, I did some blogging because I found that when I wrote things down, it helped me organize my thoughts and everything. And I wrote something called integration beyond involvement. I was looking for another I word, I guess, and integration fit the bill. It started with I. It also means like to totally integrate. It's a little stronger maybe than involvement. So 14 years ago, I wrote this piece called Integration Beyond Involvement. But starting as soon as I got out of the hospital, I actually not as soon because I didn't have much movement in my hand at all when I got home. Very little movement in my fingers, and I couldn't lift my arm at all. But so I worked on that right away. But as soon as I could, I remembered that whole concept of involvement, and I started using my hand in a lot of things. I returned to cooking, for example. I like to cook. That was one of the first things I can think of that I did. I like to cook more than wash dishes, so I probably cooked before I tried washing dishes. And so I did all kinds of things, got this concept or the little saying called therapy is all around you. And I did a lot of those things that were involvement or integration. I kept looking for something more. So I did like cleaning and dishes and cooking and laundry and things like that. Trying to use, I definitely did the thing with the refrigerator door. In fact, I used to open my left hand, open the refrigerator door with my left hand, move my hand, whatever I was putting in the refrigerator in my left hand, close it with my left hand. I just do everything. And that's a common sense thing, but it's very practical and did me a lot of good. As I moved on from there, part of this had to do with, looking for things that, I did 15 months of therapy, like 10 and 12 hours a day. And at 15 months, I just said, I'm tired of pulling on rubber bands. And I didn't stop all therapy because I walked intentionally and did intentional walking about 3 miles a day. And I kept up with the whole involvement and integration thing with my hand. But I really got tired of doing all the just repetitive single muscle or couple muscle exercises. So I pretty much cut them out and I went full time into the whole involvement integration thing. So, because I'd stopped those other therapies, I'd looked for things that I could do to challenge myself. Push mower, gardening, the rototiller. I do a lot of yard work. A couple things I find about these, high level functional activities like yard work and gardening is you don't, because you're trying to get something done, you're trying to get 5 wheelbarrows of compost, from your compost pile to your garden. So involves shoveling and wheeling and dumping and spreading and lots of different things. And you don't really realize, you don't really think about it like therapy. It is therapy, but you don't think about it like the same way you do when you're going, okay, 99, 100. You get involved in it. And I found that I did, I could do a fair amount of therapy without really thinking about it or realizing it. It was therapy. Kind of the same way when people play video games with their therapy, it involves them in a way where they get caught up in the game and don't realize that they're actually involved in therapy and tend to do it longer. So same kind of thing was true with me and yard work. Heck, we lived in the mountains, and I had a 4-wheel drive Kubota tractor with a front end loader because we had a whole bunch of property, and it was real handy for lots of things. But if you've ever driven a tractor, You know that you've got a clutch on the left, a gas pedal on the right. You got the controls for the bucket on the left, and you got a forward, backward, and speed things with your left hand. So if you want to like move forward and pick up a scoop of dirt, you are constantly doing things with all four extremities at the same time. There's just no way around it. So I actually jumped back up on the tractor and got to where I could operate it again post stroke. Then we ended up selling the land and selling the tractor, but that's a whole nother story. So I do a lot of things, around the house. I mean, I live alone, so I either have to eat out or cook. If I cook, I have to clean up after myself. No matter whether you live alone or not, you have to keep your house clean and do laundry. So I kind of just launched into the whole functional therapy thing, I guess, pretty much because I wanted to stop pulling on rubber bands the way I put it. When you were talking about specific tasks like the credit card and stuff, one of the things I did was let me do it with my affected hand, when I set a glass down, this way. If I didn't like the way I did it or pick it up, I'd pick it up again. And I would set it down. And if I, rocked it or whatever, I didn't like it, I'd pick it up again and set it down again. Oh, that was a good one. So, it was a lousy pickup. That was a good one. Nobody told me to do it. It's just another common sense thing. I thought, well, if I'm not happy with it, I should do it again. And I should leave my brain with the patterning of a good one. So I did that a lot with a lot of things, not just with putting a glass down, also with picking it up, lots of other things. If I wasn't happy with the way I performed it, I would try. Of course, in the beginning, it was really more try than success. I would try and do it over and over again until I got a couple of good ones, because I figured, hey, I didn't know anything about neuroplasticity or how the brain works, but I figured, hey, if you leave your brain with the right idea on how to do it, maybe that will help next time you go to do it. And as it turns out, like a lot of things that I just kind of common sense figured out or whatever, they kind of obey the rules of neuroplasticity and the way the brain works and recovery. So those were some of the things that I did. I've got some other things that other people have done, but I thought I'd toss it back to you, William, see if you got anything else that you wanted to add at this point, and then I'll mention some of those other things.
Yeah, sure. So, I mean, thanks for sharing all those ideas with everyone who's watching, Ralph. I think the only thing I want to highlight is, for everyone who's watching this and for everyone who's hearing what Ralph is describing and how he got straight into his therapy by obviously integrating everything into things that he liked to do, such as gardening. The reason why it was so effective for him is because everything that Ralph was doing, it actually follows a lot of research in stroke recovery, which is basically surrounding yourself in a enriched environment for exercise. And this is important because, at least in the research in recovery after stroke, what they found is that whenever you surround your brain in an environment which is an enriched environment, which has countless opportunities for exercise, it actually gives your brain a lot more opportunities to exercise. And because you've got a lot more opportunities to apply whatever your brain has gotten back, then it allows your brain to remind itself why these things it's gotten back are so relevant and why these things need to stay permanent, so that it needs to get better at these skills and movements. Because at the end of the day, your brain is wired to find different ways to become better at a particular skill or better at a particular task. It's the reason why Olympians get a lot better. It's because every day they're practicing the exact same skill, but it's under a different condition and it's under a different environment. And because they're constantly performing their movements or exercising under different environments, it forces their brain to expand that blueprint of what it thinks it already knows, so that it becomes a lot better at that skill that they're trying to perform. How this relates in recovery after stroke is, even if you get something back in recovery after stroke, and I think this is the thing Ralph and I are trying to really outline in this roadmap, it does no good to just sit on that movement and just perform that exercise as many times as you can a day. I mean, obviously in the case of Ralph, pulling on rubber bands, it does no. It's good to sit around all day pulling rubber bands, but at the end of the day, if you really want to go places with your recovery and do quote unquote functional things with your hand, now that you can pull rubber bands, the best way to move the needle in your recovery and get the ball rolling is to obviously apply some of the movements which you were strengthening or training up when you were pulling rubber bands to real life. Because when you make that transition from exercise to real life, then that's when a whole new world of recovery after stroke opens up to your brain, because your brain can actually see the relevancy of why it's practicing what it is and how this is going to relate to real life. And because it can see that connection, it's more likely that your brain isn't going to forget how to perform that movement, but rather it's going to keep working to refine that movement in real life, so that whenever you're picking up a glass of water, like Ralph said, that your brain doesn't make that mistake of, using too much effort to pick it up, but it uses the right amount of effort and it regulates the signals which it's sending to your hand in the right way, which has been refined over time, so that you can continuously and consistently get a positive outcome, which is obviously dropping the glass of water in a controlled fashion so that no water spills out, and so that you're able to go about your day just like you used to before your stroke. So I think that's something worth mentioning, because at least I've spoken to a lot of stroke survivors, and sometimes therapy doesn't have to be things that you do at home only. Therapy is not limited to the things that you do at home, but rather therapy, like Ralph said, therapy is all around you. It's just up to you to guide your brain towards connecting the dots. So like I mentioned earlier in our roadmap discussion, if your hand is loose enough, using your hand to at least open the fridge door, and then just trying to teach your brain how to regulate those signals, so that you don't close your fingers so much so that you're not stuck to the fridge door for the next half an hour trying to relax your fingers, but rather you're teaching your brain how to regulate those signals so that you can close your fingers and open the fridge door, and then relax your fingers in such a way, in a timely fashion, so that you can release the fridge door when you would like, after starting off in a situation where maybe your fingers were really tight and you were stuck at the fridge door for 20 minutes before your fingers would relax and let go. And in more cases than not, it's better to start in a place where it might be a little bit messy in your therapy. For example, going back to that fridge door example, if you're trying to teach your brain how to relax your fingers, even if you start in a place where you're stuck right next to the fridge door and you have to wait for half an hour for your fingers to eventually relax, that's a lot better than not doing it at all, because at least you're progressing towards a stage where later the time between gripping the fridge door and releasing it gets a lot shorter. So you might start at half an hour before your fingers relax, to 15 minutes to 10 minutes, and then eventually it might be 5, and maybe it might be 2 minutes or 1 minute. And then eventually, once you get really good at it, it will only take you like 5 to 10 seconds to actually relax your grip enough so that you can let go of the fridge door, until eventually you get to a place where you can close your fingers and open the fridge door and also release simultaneously on demand when you would like. So as you can see, this is why functional therapy is so important, because when you do something in real life, you get that direct feedback from the environment, which guides your brain on how to refine how it's doing something in such a way so that you can progress towards a more positive outcome, such as obviously not hanging by the fridge door for half an hour, but rather shortening the time so that you're hanging by the fridge door for maybe 2 or 3 seconds, because you can actually relax your fingers enough to let go. So, so, I think that's why functional therapy is so important in recovery after stroke. And like I mentioned at the start of our discussion, the thing which is going to make the real difference is obviously applying whatever your brain has gotten back to real life as soon as possible. Whatever movement you have, you can't ever set and forget anything in recovery after stroke. Even if you're in a situation where you can just press down your thumb, but then your fingers don't follow, you could use that to fold up clothes, or just to hold on to maybe your wallet while you use your non-affected hand to carry out the cash at the same time when you're paying for something. Something as simple as that. Any movement which you can capitalize on and apply in real life, so that your brain gets that direct feedback on what it can do better to improve how it's doing something, is extremely beneficial to recovery. And I know, Ralph, in the past, we've talked about your story about the compost bin and how initially when you were trying to do it, you couldn't do it. But after a long process of trial and error, you will eventually get to a stage where you were able to master the way you do it, and you were able to perform it as well as you did before you had your stroke. And similarly, obviously, with the glass of water, picking it up and dropping it at the same time and leaving it on a positive note so that your brain actually remembers that and it's able to apply that. And I guess know what it needs to do correctly the next time you pick up a glass of water in such a way so that you can get a positive outcome. Because at the end of the day, your brain really responds to positive feedback a lot better than negative feedback. If you can reward your brain with something positive that it's achieved after you've done exercise, the research has shown that this is beneficial for your brain when it comes to waking it up in recovery after stroke and allowing it to connect the dots a lot easier. So I guess that's really the main thing I want to add on to everything that you've shared, Ralph. And I'll just toss it back to you. Did you have any ideas or thoughts you want to add to that?
Yeah, I got a couple of things that other people have done that I do and other people have done. First thing is, I wanted to say, when I use the word rubber bands, I meant TheraBands or exercise bands, but most people don't know what a TheraBand is, so that's why I use rubber bands. I wasn't actually pulling on little teeny rubber bands. And the other thing is, I mentioned that at 15 months, I just kind of pretty much stopped, other than walking, doing the exercise part. But I didn't start doing the involvement and integration then. I started as soon as I could. As soon as I was able to do something, then I continued to do that in everyday life. You know, I once said there's no therapy better to get you ready for everyday life than everyday life itself. I mean, it sounds stupid, but it's true. So starting at a couple months after I started getting some movement, right up to 15 months, I kept challenging myself and doing more and more normal everyday tasks. So let's see, another couple of things that I discussed this with a couple of stroke survivors this week because I knew we were going to talk about it. And let's see what got mentioned. Bicycle riding. I also ride my bike. That's a real good way to get balance and exercise and not really realize you're doing it. You can go for an hour bike ride and not think anything about it. If you sit down and pull on a rubber band for an hour, you'll definitely know it. Somebody else suggested disability horseback riding. Two people said walking football, which for Americans is soccer. And one mentioned sailing. When I looked this up, what kinds of functional activities were good for stroke recovery. There were two sides to it. One was cognitive, like things like puzzles and stuff, and that's probably another discussion. But the other one said group exercise activities, which also help build community, and which, if you can't get out of your house, you can also do at home to your TV or whatever. And they were Zumba, water aerobics. That would be pretty hard to do at home. Spin, that'd be pretty hard to do at home unless you got a bike on a trainer at home, which I happen to have. I actually had my stroke on a bike on a trainer, but that's another story. And then Pilates, but you have to know how to do it. Of course, you could throw in yoga and a few other things there. And then there's the cognitive side, which we won't really get into. But so, one of the things that I think is motivating some of these people with sailing and horseback riding and bicycling and playing walking football is they're trying to get back to the things that they enjoyed doing. When stroke survivors don't know what to do with themselves or how to challenge themselves, I always tell them to, either try and return to an old hobby, even if you have to modify it, or try and learn a new hobby. And probably one of the best things you can do in functional therapy is, because it's challenging yourself, is learn new things, whether they be physical or mental. When you're trying to learn new things, you're challenging your brain and you hardly know it. So those are just some things that other people have found beneficial in terms of functional therapy. So that's about all I got. Unless you got anything else, William, I'd say we'll end this one and see everybody again.
No, I don't think I have anything else to add. I think the only exception to the rule of doing things you enjoy is obviously, if you went to the gym a lot and you used to do a lot of weights before your stroke, I would be quite conservative with that one, because going to the gym after your stroke, especially if you've gotten back some movements in your recovery after stroke, when you add weights to the equation, if you're not at the stage where you can voluntarily control and send those signals from your brain and control your movements, then going to the gym, it can be a double-edged sword, because if you're going to the gym and you're adding weights and you're putting your brain under pressure to perform certain movements with the added weight, and you still have a little bit of muscle tightness or spasticity, sometimes it can actually encourage your brain to get into a situation where it's using too much effort than is necessary to perform some movements which would have only required a little bit of effort before you had your stroke. And sometimes going to the gym and doing weights in your recovery, it can result in bad habits in your recovery after stroke. It might force your brain to turn on muscles more than necessary, rather than turning them on in a controlled way, so that you don't end up compensating too much when it comes to sending those signals to your muscles to do things in your everyday life. But other than that, I don't think I have anything else to add. I think functional therapy, at the end of the day, the real difference, like I said, is making that leap from doing exercises at home where you're working on one movement, such as pulling rubber bands, and applying this to real life, where you're able to obviously do things such as open the fridge door, wash dishes. Another one is holding the toothbrush with your affected hand, while you use your non-affected to squeeze toothpaste on it, or even using your affected hand to hold a medicine, I guess a medicine.
Pill charge.
I guess a medicine jar, and then taking out the pills out with your non-affected hand as well. So these are just all little things, and as you can see, Ralph mentioned earlier with the idea of integration, you are really integrating all of the movements that your brain has gotten back after your stroke into real life, so that your brain gets that direct feedback and knows what it needs to do to become better at these, so that you can start to see more improvements in your recovery as you go along. Because unless you're a fan of doing exercises while sitting down at a desk and picking up blocks all day, the way to really graduate from that is to do this in real life. Rather than picking up blocks, you could aim to pick up something like fruit or oranges. And obviously, in that case, there's a challenge because if you drop the orange, it's obviously going to make a mess and it's not going to be good. But that's just one of the few examples. Ralph and I, in this roadmap, we've shared a lot of examples. Some of these may be relevant to you, some might not be quite relevant, but I encourage for all of the folks watching to really just think about how these might relate to your situation if you think that they would be beneficial to your recovery, and give them a try, especially the fridge door one. If you're in a situation where your hand is flexed up or balled up in a fist, at least trying to use your other hand or your non-affected hand to try and open up your fingers to get around the fridge door and start from there, and then slowly build up and see if you can get an improvement. It might take a long time, but if you look at the lifetime benefit, I'm assuming you don't want to be stuck next to a fridge door for half an hour.
I would encourage people to go back to the gym, but you and I feel the same way about weights. I never introduce, I only in a few times, in few situations that I ever introduce weights. Like you, I'm a big believer in repetitions, and if you use weights, light weights. In fact, anybody who wants to know more about this, we did one on weights about a year ago, and it's in the playlist, and you can look that up and learn more about what we thought about weights. But I would encourage people to go to the gym, just not try and be the person they were before their stroke. If you go to the gym, it's, what you need to do is figure out how to integrate the gym into your personal therapy program based on what kind of stroke you had, what your capabilities are, where you're at in your recovery, and that kind of thing. Those are things that neither William nor I can really tell you. Those are kinds of things that you have to sort of figure out for yourself. Like a lot of this, if you're practical, logical, have some common sense, you can figure out more than somebody who doesn't try and hone those skills. So with that, William, I guess we'll wrap this up and we'll see everybody next week.
All right, thanks, Ralph.